Hi there, it's Dr. Brian McKay from Neuropathy Core Health, Fairfield County's largest alternative for integrative therapy for neuropathy. And what I want to discuss today is certain vitamins and supplements that really can make a difference because we want the internal working of the body to be as healthy as possible. So the more, let's face it, somebody with neuropathy, be it from chemotherapy, idiopathic, or diabetes, is going to have a compromised immune system. So supplements can definitely make a big difference in creating a healthier environment from within that would really, really benefit the person suffering from neuropathy. But again, I want you to make sure you're running these things by your healthcare provider. Hopefully, they're knowledgeable. Um, I'm going to start out today with the B vitamins. The B vitamins are basically your nerve vitamins. And there's rampant deficiency. I mean, part of it is the American diet. Um, the bleached flours and stuff take out any kind of the B vitamins that we normally would get from better non-GMO type of food products. But there is evidence to support the use of B vitamins for neuropathy, especially when there's deficiency. And let me tell you something: most people will have deficiencies, even people who aren't suffering from peripheral neuropathy. It's one of the most common deficiencies in the diet, and it's due to the diet. For one thing, as I already mentioned, medication use will also interfere with the uptake of the B vitamins, and the ability of your body to absorb vitamins. I particularly like to recommend a company called Standard Process out of Palmyra, Wisconsin. Their their vitamins are based on food. It's a whole food product, so you're really going to get an awful lot. You're going to have a much better shot of absorbing the B vitamins when the body recognizes it as a whole food. You know, so I guess the biggest one is B12. B12 is methylcobalamin, and that's a really important one. B6, pyridoxal 5 phosphate, and benfontamine, which is a form of vitamin B1. So there is clinical trial evidence supporting the use of these B vitamins to reduce the symptoms of neuropathy associated with diabetes. Not as much with the CIPN or chemo-induced peripheral neuropathy, but the other thing too you got to be careful of: sustained high dosages can cause toxicity, leading to neuropathy. So it's almost like if you're taking mega doses of B vitamins, it's probably not a good idea. You know, Especially that's why you want to have this managed specifically with your healthcare provider. Let's go on to vitamin D. The research has noted an association between low vitamin D levels and the presence and severity of neuropathy and diabetes and after chemotherapy. So again, we're looking at diet, medication, and reduced absorption levels. So vitamin D can be measured with a simple blood test, but I don't think it would hurt to be on a vitamin D. And also, too, is um, brief daily sun exposure, as well as that are rich in vitamin D, are a great way to maintain a normal range. Vitamin D deficiency is rampant, especially in the winter. In the summertime, you may want to get outside a little bit more. A little bit of sun is not a bad thing. I really want to stress that a little bit of sun is not a bad thing. So your vitamin D levels are, something that you could definitely supplement. Um, Curcumin basically it's part of the turmeric root, and it's one of the most widely used and researched natural medicines for pain, and has been shown to lower oxidative stress, pain, and inflammation, as well as to have neuroprotective effects. Pretty huge. I mean, how do you not have um, how do you not want to have neuroprotective effects, especially in light of all the stuff going on? For this particular one, I really, really, I really urge. Again, the standard process has a division called MediHerb, and these are herbs. Curcumin is an herb, and this is called turmeric forte. Um, I highly, highly recommend the turmeric forte because not only does it have the turmeric, it also has fenugreek seed, which is a powerful. It kind of ramps up the ability for your body to take in and actually use the turmeric. So you kind of you know you're. I think you'd be well advised. standardprocess.com. You have a question, my phone number is 203-656-3636, 203-656-3636. I'm more than happy to turn you on to this stuff. I stand by these. I actually been out to the manufacturing facility, watch them harvest. It's all organic. They take a lot of care in producing these supplements. To me, it's the highest quality that I can actually stand behind. I mean, surely you can go to CVS or Walgreens, or you can even head up to Costco and get vitamins. But is the vitamins, excuse me, are the vitamins really? Are you really getting the benefit from it? Now, fatty acids. Gamma linoleic acid is an omega-6 fatty acid found in evening primrose oil and borage oil. Gamma linoleic acid is an essential component of myelin. Now, we all should know at this point, it improves nerve function, especially with diabetes. There's a bit of a difference between omega-3 and omega-6. And I'll go into the omega-3s, but you really want to get a balance between the two things. The one thing is you need to make sure that you're not on a blood thinning agent like aspirin or warfarin. That's something you really need to talk to your doctor about before you go on omega-6s. The omega-3 fatty acids, they're found in fish, walnuts, flaxseed, and it's crucial to nerve health as well. EFA, essential fatty acids. What you need to know is it cannot be made by the body and must be supplied by the diet. And since the covering on the nerves, the myelin is comprised of basically 70% fats, essential fatty acids are required for myelin function. Just a word of advice, sometimes if you're on cholesterol medication, you're going to have lower levels of omega-3s in your body, or these essential fatty acids. So it's one of those things to be concerned with, because suppose you back down a little bit on that. But that's something you have to deal with your primary care doctor who's addressing your overall condition. But this is for you to be educated on and to ask questions, and hopefully your primary care doctor has some answers for you. The omega-3 fatty acids in supplement form has found to be protective against peripheral nerve damage from chemotherapy. And there's also evidence that it can improve the nerve's ability to regenerate. So I don't see a way that like I said, essential fatty acids. You need to have these essential fatty acids, these omega-3s, and you want to balance between the omega-3s and the omega-6. Acetyl L-carnitine. I've done a number of projects on acetyl carnitine, and it's an amino acid produced by the body naturally, and it helps produce energy. And as a supplement, has been studied pretty heavily with neuropathy associated with diabetes, and studies shown acetyl L-carnitine has been shown to improve the pain of diabetic neuropathy, as well as aid in nerve regeneration. So the idea here is if you can regenerate those nerves, you're going to have less neuropathy. So I hope it makes some sense. It's also well tolerated, and some people do have some gastrointestinal side effects from acetyl L-carnitine, but I think that's a matter of playing with the dosage, and again, going over this with your primary care doctor. The primary care doctor should be up on all this stuff, and if not, you can reach out to me. I'm more than happy, but I'm not going to take your advice has to come from your doctor, not from me. So alpha lipoic acid, and again, that's a naturally occurring fatty acid, and it can be found in small amounts in yeast, spinach, broccoli, potatoes, organ meats. It has an antioxidant effect, and it's supposed to protect against free radical damage. ALA is a supplement that's been extensively studied and used in Europe for the treatment of neuropathy associated with diabetes. And it can also help protect against nerve damage. So we don't see a neurodegenerative effects, but we definitely see that it's well tolerated, and alpha lipoic acid is something you should be considering. So what we've gone over today is we've gone over the B vitamins, vitamin D, curcumin, gamma linoleic acid, omega-3 fatty acids, acetyl L-carnitine, and alpha lipoic acid. And you need to have a really full frontal approach when you have neuropathy. Neuropathy is serious. It's a comorbidity with underlying pathology, that really has to get treated. I mean, if you got diabetes, got to get treated. This is one of the unfortunate side effects. But if you can do more in your power to do so, and also let's take a little step aside. What about walking? I mean, when that leg pain gets really bad, or you can't feel your feet, you're more likely just to sit down in front of that TV and not move. If it hurts to move, why would you move? And I understand that completely. But that then sends it sends a poor message in general, because you're going to sit more often. You're not going to get the blood flow, and the area that needs the blood flow is the legs primarily. I mean, you do get in the hands, but the lion's share is going to be in the legs. And the reason why is the legs are furthest away from the heart, harder to get blood flow down to that area. So, I mean, I really encourage you to, get up and walk around, even if you just walked in place. I mean, typically go stand behind your couch if it's not against the wall or a chair, so you have stability, and just raise your legs up. You can listen. You can hold on at first. I mean, depending on how severe your neuropathy is, you can hold on. Hold on with one arm. Um, Hold on with two if you have to. But the idea is move those legs. You got to move the TV show, move that bus. Well, you got to move those legs to really make a difference with your neuropathy. And then you can play with it a little bit, where you can hold on with one hand, stand on one leg, the opposite. So say you was going to stand, and think about it this way. You're going to, if you're holding on to the couch, and if you have neuropathy, don't be afraid. It's not a race here. It's just a matter of stimulating not only the blood supply, because you're standing up and you're going to get more blood flow to the legs, but you're also going to stimulate the nerves dealing with balance. So what I would suggest you do is um, hold with your left hand, stand on your right, okay, and just stand there, and you can, raise up the left leg. That's the side where you're holding the hand, and stand there for a minute, 2 minutes. And that sounds like a lot in the beginning, but work your way up to 2 minutes. And then switch it out and go over to where you hold on with the right hand and you stand on the left leg. Um, I don't think you can hold on with two hands and stand on no legs, but if you can, please let me know. I'd like to see that. But the idea here is here's some simple things that you could be doing, because neuropathy isn't just something you have to heft on to your doctor and have him deal with it, because a lot of MDs are very frustrated with neuropathy, because let's face it, it's very frustrating. It's frustrating for you, it's frustrating for the doctor, because the main concern for the primary care doctor is the primary morbidity, the diabetes, the chemo, the cancer causing that you need the chemo. So I think if you take a common sense approach, there is help. Understand too is your body's inability to absorb and really uptake these supplements is your body's just not as efficient as you get older. So these things have a role in it, and kind of a cascading effect downward, that if we can cycle you up and get you out of it, and just creating a healthier environment inside, you're going to have a better outcome. And that's really what it comes down to. We want a better outcome for you. Um, Obviously, the whole neuropathy field, we're not concerning ourselves with the primary morbidity, the cancer, or the diabetes, but these things do need to be addressed, and the comorbidity being the neuropathy is fairly serious. I'm Dr. Brian McKay from Neuropathy at Core Health. We've been doing neuropathy treatments for several years. We keep reinventing what we do to get better results. Recently, we added the Hacomed. It's a German treatment that stimulates the nerve to regenerate. And it's been pretty effective so far. Obviously, during the COVID-19 timeframe, we're not going to have the same. We're kind of quiet around here because people aren't coming out, which is totally understandable. But it's hopefully that through podcasts like this, people can listen and learn, and hopefully get the idea that they're going to help themselves, which is really what is really, really important to me. So it's the idea is like, take charge of your health, be a partner with your healthcare provider, not just a willing participant. And I'd like to thank you for listening. Again, if you have any questions, you can reach out to me, 203-656-3636, 203-656-3636. I'm Dr. Brian McKay from Neuropathy at Core Health. You have yourselves a great day, and let's look forward to when this whole COVID-19 is over and we have a vaccine that can help it, and stay healthy in the meantime. Thank you very much.